Okay, guys, good afternoon. Good afternoon. How are you? I hope everything is good. Let's start our practices. Let's start our practices. Let's check. This is the 26 groups. Let's check to you guys. Okay. So can you tell me, please, guys, what you know about the general examinations? What do you think about the general examinations? Mobin.
Ma'am, is the collection of objective information from observation and or from examination techniques.
Okay, you said about the physical examinations. You said about physical examination. I want you clear your mind. I want you clear your mind. Uh, our examinations, physical examinations, is divided into two parts. Number one, it is the general examinations. Again, you turn off on your camera. Turn off your camera. If you will not turn on your camera, I will done my practices. If you disappeared even one times, we will done our practices. So physical examinations divided into two parts. First of all, number one, general examinations. Number two, physical specific examinations, when we are check the systems. So your homework was the general examinations at all. So can you tell me, please, general examinations consist of what, Mubin?
Ma'am, general examination basically consists of four techniques. First one is inspection, then palpation, then percussion, and then auscultation.
No, you talk about the physical examination at all. But I'm asking about the components of general examinations. I mean the components of general examinations. Sana. Sana. The
Yes,
components
ma'am.
of the components of general examinations. Aisha. Aisha Sadiq.
Yes, ma'am.
The components of general examinations. General examinations includes what?
No, I don't know.
Okay, who can reply to me?
Ma'am, objective and
Ma'am,
subjective.
general appearance.
No,
Is it
no.
again?
Shanza Meg, what's your
Yes, ma'am.
reply?
Ma'am, first of all, we will check the general appearance of the patient.
Can you repeat, please?
Ma'am, general appearance of a patient, how the patient is looking, his consciousness, his position.
Okay, yes. What else?
Yes, ma'am. Then we will check his organs from head to toe, in which include skin, face, eyes, mouth,
Okay, what else?
and yes, ma'am. And we also check the vital signs which include temperature, pulse, um, pulse rate, and ma'am, respiration rate, and blood pressure.
Okay, thank you so much. Yes, you are right. You are right. General inspections consist of the general conditions of the patient's state of health. Please read this slide, Usama. Usama,
Yes, ma'am.
read this slide.
Ma'am, general conditions of the patient, state of health, consciousness, position, physique, measurement of body temperature, facial expression, assessment of the condition of the skin, nails, hair, mucous membrane, lymph nodes, muscles, bones, joints.
So see guys, your general examinations or your general survey or your general inspections consist of these points, of these components. Every component of these points that you see number 1, 2, 3, 4, 5, 6, one by one you should to express me, you should to describe me, you should to explain me. What does mean number one does mean number two, and they are follow like this one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 points. So 15 components, each every you should to check. You cannot start from the hair and nails. You cannot start from the checking of the muscles or mucous membrane. You start from the state of health, then you go to the consciousness, then you check position, then you check body build, then measurement of the body temperature, then you go facial expression, assessment of the condition of the skin, nails, hair, then you go to the mucous membranes, then subcutaneous fat tissue, lymphatic nodes, muscles, bones, and joints. Of course, more in detail, we will talk muscles, bones, and uh, joints at the we will talk at the where at the skeletal muscle system. So from you, I need the informations or describing till the 12 points. Okay, 13, 14, 15. We will study later. So, can you tell me please, what does mean state of health, Ali Hassan? What does mean state of health, Ali Hassan? State of health, Ali Hassan. See,
Yes, ma'am.
yes,
Ma'am, state of health.
yes. What does it mean?
Ma'am, state of health mean the complete physical, mental, and social well-being, and the absence of disease or infirmity in the body.
How you understand? Give me your explanations by your words. How you understand state of health? I don't. You know, guys. I don't need Google understanding. I need that you
Ma'am,
understand it. You get these topics. I need this one. So can you
state of the
tell me,
health, ma'am.
please, state of health? How do you think? What does it mean?
Ma'am, it's a body, physical or mental. It include the body, physical, mental state, and the absence of the disease or infirmity in the body.
Okay, so here is okay. You are right. I am agree with you. But here is a little bit something. State of health. When the patient come to you at the first time, you can say, okay, this patient is ill, or this patient is well, or this patient is worse or severe. So like you can give the category of these patients.
Ma'am, for example, if a person can do all the basic daily work by himself, or allow that individual to do cope with all the demands of daily life, it means that he is present in perfect state of health.
Yes, so, but exception is that. Exception is that when you are evaluate the state of that patient, you cannot do it only by coming first time. For example, your patient hospitalized, located at the hospital. You are a doctor, come to the hospital and see the today's state of health and check and put in your case history. So you observe your patient during the 10 days that he will be located at the hospital. So during the 10 days, an example of your observations, then you can finally give the result of state of this patient. Okay?
Okay, ma'am.
Okay, thank you. I would like to talk with Sid. Sid, can you understand me? What does mean consciousness? Sid, can you explain me what does mean consciousness? Can you explain me what does mean consciousness? Sid, if you are not replying to me, so it means you are absent at the practices. And I will put absent if you will not reply to me. If you don't know, so say me. I don't know. Okay, you are absent today. Sabir Amina.
Yes,
Sabir
ma'am.
Amina. Can you tell me please how you understand the consciousness? What does it mean?
Ma'am, the patient can move freely with any restriction can be seen in the normal adjust and any disease. If patient cannot adjust or move her body,
What else? What else? Consciousness. Amina. Amina.
yes,
Can you
ma'am.
tell me please, you are in consciousness now or you are not in consciousness now?
I am conscious. Not
Conscious,
in
yes.
conscious.
Why
Yes,
you
ma'am.
are in consciousness, Amina?
Because, ma'am, my mind and my body is active, and I can feel what you're saying and
Okay, yes.
observe
Now you
my
explain me good. Yes, you are right. You are in the consciousness. That's why you
yes,
are
ma'am.
sitting at the practices. That's why you are listening my practices.
Yes, ma'am.
But in the medicine, they have what levels? Amina, can you please read this slide?
Yes, ma'am. Level of consciousness is the patient awake, alert, and responsive to you and other in the environment. If not properly assess the level of consciousness.
Okay. Can you tell me, please, what kind of levels of consciousness do you know?
What, ma'am?
What kind of levels of consciousness do you know?
Ma'am, when patient
I'm listening you. I'm listening you. What kind of consciousness level do you know?
It means
Okay, read the
the
slide.
patient
Read the slide. Here is the level of the
alertness
consciousness. Look at
and
this. This
level
is the
the
level.
alertness
Wait a minute. Wait a
and
minute.
technique. Yes,
Wait
ma'am.
a minute. Here is the level of the consciousness.
Yes,
Here
ma'am.
is how you should to check these levels.
Yes,
And
ma'am.
this is the how the patient responds to you. Okay.
Yes, ma'am.
Amina, please read number one. Then you should to say how to check, and you should to say how the patient responds.
Okay,
Read,
ma'am.
please.
Level alertness and technique. How can we check consciousness level? Speak to the patient in a normal tone of voice and patient response. The alert patient open the eyes, look at you and respond fully and appear priority to the stimulate as usual intact. And second, lethargy. Speak to the patient in a loud voice, for example, call the patient name or ask, how are you? And patient response, the patient appears drowsy but open the eyes and look at you, respond to questions and then fail asleep. Bantations and shake the patient gently as if a ankling and slipper. The patient responds, the obtained patient open the eyes and look at you but responds slowly and somewhat confused. Alertness and interest in the environment are degrees.
Okay. Moving. Keep going to read the slide. Moving.
Next level of consciousness is ma'am stupor. Uh, in this technique, we will apply a painful stimulus to the patient. For example, pinch a tendon or rub the sternum or roll a pencil across a nail bed. No longer stimuli needed. And patient's response will be uh, patient arises from sleep only after painful stimuli. Verbal responses are slow or even absent. The patient lapses into an unresponsive state when the stimulus ceases. There is minimal awareness of self or the environment. Then the next level of consciousness uh, is coma. In this technique, we will apply repeated painful stimuli, and the patient response will be a patient comatose. Patient remains unarousable with eyes closed. There is no evident response to inner need or external stimuli.
Okay, so see guys, this is the levels of the consciousness and you should to know, learn by heart this table. But in Russian speaking country, we use this is three levels. Number one, stupor. Number two, sopor. Number three, coma. So unconsciousness people, actually we will call coma. Not unconsciousness, coma. So there is something like a reasons or cost of this coma. Alcoholism, apoplexy, hypoglycemic, diabetic, hepatic, and epileptic reasons you can see in the coma. Here is, for example, stupor. This is the patient now located in the stupor, or in English we can translate something like a numbness. So see of the patient's face. There is no emotions, nothings, and actually this is the levels happening mostly by a psychiatric problem. By a psychiatric problem. Maybe this is the patient is in depressed or under the stress, something the psychiatric problem. The next one, I said the SOPER. SOPER, in the SOPER, the patients can give a little bit response to you. The reflexes is keep in their body and they can, by the forceful questions or by the uh, loudly questions, they can give to you response. Actually, SOPER's people's, it's like something a half coma. It's like something a half coma, sleeping. SOPER actually translate to the English sleeping. Then in these positions, you can see coma. So patient's unconsciousness cannot do anything. So it is the very bad actually conditions. So in these conditions, patient can die. In a coma, there is the only two ways. Or these patients wake up, or these patients die. Very dangerous situations. Okay, so what you will put in your case history? You will put the consciousness is clear, confused, or abnormal or normal. Okay, but you will be more in detail study from the nervous system with the nervous system. Okay, I want to talk about the position and posture. And I would like to ask about this one, Aisha Sadiq. Aisha
Yes, ma'am.
Sadiq. Can you
Yes,
tell
ma'am.
me, please, what does it mean, position and posture of the patient?
Ma'am, position and posture refers to patient body status and the general way of holding the body. Ma'am, and it's divided into active, passive, and compulsive.
Okay, yes, you are right. Can you tell me, please, what does it mean, active position?
Ma'am, in active position, the patient can move his her body freely without any restriction. It can be seen in normal adult patient with mild diseases or at earlier stages of the diseases.
Okay, what does it mean, passive position?
Ma'am, in the passive position, the patient can't adjust or move his her body. It occurs in extremely sick or patient with unconsciousness.
For example, an example, give me please an example. Passive position.
Ma'am,
Yes. For example, coma. Coma.
yes, ma'am.
Example, coma. Coma, it is the passive positions. Very bad situations, I said. It is the dangerous situations. If you see the position of the patients is in the passive. Okay, can you tell me please, what is the compulsive?
Ma'am, in compulsive, ma'am, the patient in this phase, the patient lie down on the back, the two legs bending.
Why? Can you tell me please how you understand the compulsive position? I need your understanding. How you understand compulsive position? I need your understanding. Can you fastly, guys, because I'm really tired.
Um, Ma'am, ma'am having power to compel force to restore the compulsive measures.
So, Sana, compulsive positions, when the patient,
Yes, ma'am.
what does it mean
Mm,
compulsive? How you understand it?
ma'am, you mean having the pain only one side of the body.
So it means the patient try, force his make a position to why he forcefully positions, why the patient do the forceful positions. How do you think? It is very simple. It is very simple, Sana. It is very simple. They actually do for what? For decreasing their pain. Look at this. Look at this picture. All these people do the compulsive positions. Why? Because they have a problem with the stomach. And you know the problem or stomach pain can be so severe. That's why they do the forcefully positions. And this is the positions what you see at the slide. It is the supine positions, compulsive supine positions. You cannot say the patient lie down on the back in your case history. When you write the case history, you use what? Medical terminology. So this position we call actually compulsive supine positions. Shanzameh, can you tell me please, what else, what kind of compulsive positions do you know?
Ma'am, when the patient feels pain in any part of his body, he try to relieve the pain and change his position according to the pain. Like, ma'am, sometimes patients move side down. Sometimes patient use the side
Lie
down.
down, okay, I need a name. I need a name. You know,
Yes, ma'am.
guys, you should to learn by heart all the medical terminology. You understand by your words, okay, I see, but never forget to learn the medical terminology.
Yes, ma'am. And scale down position. Ma'am.
हाँ 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 सब बता दो.
Your microphone is off.
यार मैं थक गई है, बस करो.
मैम को घर वाले डांट रहे थे.
तू चुप कर कान्ना का.
गंजिया
कटा.
दाल और किधर है?
टूल पंजाबियां दा दाल खोर.
Okay, guys. The next one is the compulsive side down positions. compulsive side down position. So it means you should to learn by heart the name of the positions. You can see when it's happening, when the patient has, for example, pleurisy or something inflammation of the layers. So it is the compulsive side down positions, down positions. And I have a question. In which position, in which side will do the side down position these patients? For example, here is inflamed pleura and healthy pleura. Can you tell me please, in which side will we do side positions these patients? To the healthy side or unhealthy side? How do you think, guys?
An unhealthy side.
Healthy side or unhealthy side? How do you think, guys?
Ma'am, on unhealthy side.
Why? Now explain me why.
Ma'am, because he will try to relieve his pain.
No, the patient will do side down positions to the healthy side. You know why? Because there is the inflamed pleural layers. They will be, if you remember, pleural layer consists of two layers. What kind of? Parietal and visceral layer, pleural layer. So when the patient do the side down to the healthy side down positions, to the healthy side, so will be not so much frictions of these layers. There will be not so much frictions of these layers. So, and the pains of the pleurals will be decreasing. That's why the patient actually do the normal side down position to the healthy side positions, to the healthy side. Okay, I hope it is understandable for you. Here is pleurisy again. So patient can hug like this one, the chest of the or the chest of the by the hands and lead a little bit forward. Also for why he is doing to decrease the pains of the two layer pleural layers. Okay. I have a question. What is happening if there is like pneumonia or lung abscess or bronchoectasis? Which side will be side down of the patients? And which side? Ali Hassan. Ali Hassan.
Yes, ma'am.
So in which side, if there is the, for example, lung abscess or something like problems with the tissue of the lungs, in which side the patient will be do side down, in the healthy or in the unhealthy side?
Ma'am, unhealthy.
Unhealthy, yes. Why?
Ma'am, to reduce the pain caused in the lung, the he will lie down on the unhealthy side, so that the muscle of the his abdomen they can relax.
No, because he will try. He will try. For example, if there is the like a lungs problems. Look at this. Not plural, plural also, but later. But there is the lungs tissue problems. The patient will be side down to the unhealthy because the normal lungs tissue will be breathe better for the better breathing and coughing. Okay.
Okay, okay, ma'am.
Okay. Here is, this guy also have the lung abscess and he tried to lie on a sore side. He tried to lie on a sore side. Look at this. Due to breathing excursion, due to more better breath. I want to talk about the orthopnoea. Orthopnoea, one of the important lectures. Usama Savdar, can you tell me
Yes,
please?
ma'am.
Can you tell me please, orthopnoea? What that? Read the slide before.
Ma'am,
First of all, read
an
this.
abnormal condition in which a person must keep the head elevated, sit or stand to breathe deeply or comfortable, or wakes up suddenly in the middle of the night, sort of breath. It can be seen in the patient with lung or heart disease.
Okay, okay. So now, can you tell me please, how do you understand this one? How you understand the orthopnoid position? In English, we can say sitting position, but we are a medical person. We use medical terminology. Sitting positions, it will be orthopnoia from Latin words. So please, Ali Hassan, explain me please. What does it mean? How do you understand it, Ali Hassan?
Yes, ma'am.
So how you understand this one? Who understand? Who can explain to me? This is sitting positions. Who can explain to me? Aisha, Aisha,
Yes, ma'am.
can you explain me orthopnea position?
Ma'am, in orthopnea, ma'am, in this patient have shortness of breath.
Okay, then
Ma'am, that occur in when lying flat.
okay, yes. Why? Because they cannot breathe, right?
Yes,
They
ma'am.
cannot breathe and they are trying to do orthopnea position. Okay, Aisha, can
Yes,
you
ma'am.
tell me please, in which systems dysfunction? How do you think it can
Yes,
cause?
ma'am.
Is it? How do you think? Is it can caused by dysfunction of what system or problems in which organs? You can find the orthopnea position. Aisha.
Ma'am, this is this caused by increased pressure in the blood vessels of your lungs.
No, it can be caused only by mostly by two organs. Number one, it is the heart. Number two, it is the
Yes, ma'am.
lungs. By two
Lungs.
dysfunctions of the two organs, mostly cardiovascular
Yes, ma'am.
problems or respiratory problems. Okay?
Yes, ma'am.
Okay, thank you. Let's check next one. Here is, look at this guy. This is guys actually in the orthopnea position. due to heart problem. Due to heart problem. You know, the diseases of the heart, they are what to do. They are the can give complication and heart failure. In the heart failure, so they cannot lie down in supine position because there is the like what happening increases venous return, and in the patient with the left ventricular impairment may precipitate pulmonary edema. So when he lies down, the blood goes, if you remember the circulations, pulmonary and the systemic circulations, how they work. So the blood goes and increase the pressure of the left ventricle, then left atrium, then vessels, venos, pulmonary vessels also increase the pressure and stay. Blood stay and gives the edema of pulmonary or lungs edema. And that's why the patient cannot breathe when he is lie down. That's why actually in the heart system it is happen when the patient have chronic diseases. For a long time he has the heart problems, and actually they're complicated by the heart failure. Okay guys, and you can notice this is the guy used the three pillow. So the or if there is the heart problems, the patient will use the pillows 2, 3, 4, not lie down. But I also say about the respiratory problems. So the patient can also be in the orthogonal positions by the respiratory problem. So look at this picture. This is two pictures of the patients who has heart problem or who has respiratory problem. Can you tell me please, what is the differences of this one? What is the differences of this one? Muhammad Jehanzaib.
Yes, ma'am.
Can you tell me please, what is the differences of these two guys?
Ma'am, the patient chokes or gaps for air and it sits in the edge of the.
Oh guys, look at this. Okay, we understand the reason of the heart problems, and you also can notice there's the pillows, and he's sitting relaxably sitting. But this guy sitting very not relaxable. He is fixed his food, fixed his hands, and not example, notice how what is doing with the shoulders, what is doing with the pectoral girdle muscles. He is fixed everything to breathe, help additional muscles for breathing. Look at this, muscles of the shoulder, muscles of the neck region, muscles of the pectoral girdle. So in this position, he can catch an air. This is the actual patients with bronchial asthma. This patient has the bronchial asthma, and he only tried to gasp for air and sitting on the edge of the bed and try to catch an air. Okay, is it understandable for you?
Yes, ma'am.
Okay. The next one, we also can identify square down position, rest position, toss and turn position, opistotonus. But this is the positions you will study in the children diseases subject. Okay. For me, important previous three side down, supine, and orthogonal positions. For me, important previous three positions. Here is our typical positions of the COPD patients. This is the respiratory problem. Look at this. This is the respiratory problem. Look how he fix hands, fix food, and try to catch an air by using the additional breathing muscles. Okay, guys, that's why don't smoke. If you smoke for a long time, 15, 20, 25 years, you will get this is the patient like, you will be the patient like this man. So stop smoking. Really, smoking is the really very bad things for the health. Okay, let's see what we have at the next one. It is the when you check the gait of the patient and Muhammad Jahanzai read the slide.
Yes, ma'am. Gait is a way or manner of walking, and gait abnormalities describe unusual and uncontrollable problem with walking.
With walking, yes. And in this picture, you can notice when the patient come into your office, you are, for example, a doctor, and the patient come into you, so you should to notice how he come to you. By using this one, I forget how it's called in English, this one. Or he is coming like this one, this the case happening in the Parkinson's disease, or pay attention how comes these patients. There is like a what um, differences, like look at this, the betweens of these um, legs of these two foots. It can happen in the cerebral ataxia, foot drop, or sensory ataxia. So, you know, guys, about the gait, you also will study more in detail and the nerve system Okay, but you can read my slide a little bit. You can read my slide and see he's absent, right? See it is absent. Um,
I'm not absent, ma'am.
oh, you are not absent. Okay, see,
My
can
name
you
is
read
Guljan.
this slide? Read this slide.
Ma'am, spastic hemiparesis seen in corticospinal tract lesion that cause poor control of flexor muscle during swing pace, for example, from stroke. Affected arm is flexed immovable and held close to the side with elbow, wrist, and interphalangeal joint flexed. Affected leg extensor are spastic, ankles are plantar flexed and inverted. Patient may drag toy, circle leg stiffly outward and forward, circumduction, or lean trunk to contralateral side to clear affected leg during walking.
Okay, please also read next slide.
Another one, ma'am, is
Okay, wait a minute. Take a rest. Okay, take a rest. Leader of this group, read this slide.
Step gait, ma'am, seen in foot drop, usually secondary to peripheral motor unit disease. The patient either drag the feet or lift them high with knees flexed and bring them down with the slab onto the floor, appearing to be walking upstairs. Patient cannot walk on their heels. Gait may involve one or both legs. Tibialis anterior and toe extensors are weak. The next one is cerebellar ataxia. It is seen in disease of cerebellum or associated tracts. Gait is staggering and unsteady with feet wide apart and exaggerated difficulty on turns. Patient cannot stand steadily with feet together, whether eyes are opened or closed. Other cerebellar signs are present, such as dysmetria, nystagmus, and intention tremor. Next one is Parkinsonian disease, seen in basal ganglia defects of Parkinson disease. Posture is stoop with flexion of head, arms, hips, and knees. Patients are slow getting started. Steps are short and shuffling with involuntary hastening. Arm swings are decreased and patient turn around stiffly, all in one piece. Postural control is poor. Next one is sensory ataxia. It is seen in the loss of position sense in the legs from polyneuropathy or posterior column damage. Gait is unsteady and wide based with feet wide apart. Patients throw their feet forward and outward and bring them down, first on the heels and then on the toes with a double tapping sound. Patients watch the ground for guidance when walking. With eyes closed, patient cannot stand steadily with feet together, and the staggering gait worsens.
Okay, thank you. So, guys, unfortunately, I have to go for some deal at the university. So, we will keep going, talk about the general examinations and the next practices. So, please prepare more better. I'm not satisfied today's answers of you. Please, you should to be more smarter than me because your brain is fresh, you are fresh, and you are have a wish. So that's why please prepare and be ready more better. Okay, the what you do today is good. I'm not saying bad. It's good, but I request this is information. It needs for you, not for me. Okay, it's information needs not for me. It needs for you. Okay, so thank you guys for your homework. You understand it. And at the model, there is the task number 3. There is the task number 3. You should to do the task number 3 at the Moodle right now. I am turning off the Zoom, but I am in the Moodle. So open your Moodle and do the task number 3. Okay, guys?
Okay, ma'am.
Okay, ma'am.
Okay, ma'am.
Okay. Thank you, everybody. Bye.
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 Goodbye.
Ma'am.
Allah Hafiz.
Allah Hafiz.
Last,